Joanna, and I head community engagement for Innopark Ventures. And this webinar is a part of our Matchathon 2020. Over to you to introduce Vaibhav Tewari today.
Thank you, Jo. Thank you so much, Vaibhav, for being with us today. Innopark Ventures warmly welcomes you and the rest of the audience. I think we have members of the audience joining in as we go along. Just to introduce Vaibhav to everybody, I know you've seen posters of him everywhere saying he's the CEO of Portea. Vaibhav is actually one of the in his capacity to up to 4,000 employees. Portea is the largest consumer healthcare brand outside of hospitals in India. Vaibhav has played an instrumental role in what Portea is today. Again, today we leave it, the screen is open to you, as we are saying these days at the webinar, for you to please take us through the journey of Portea and also tell us a little bit about what is it that the healthcare sectors are doing during the pandemic, and what does it look like post-COVID? What kind of support, what are the new evolving things with the healthcare sector? Thank you so much, and over to you.
Great. Thank you, Sita. Thanks for inviting me and giving a great introduction. And good morning, everyone. What I thought when we got discussing on what we can present about healthcare, I thought I can quickly take everybody through what Portea is all about, what we do, and in these COVID times, what kind of innovation opportunities have been there, what we have done as an organization. And then, of course, we also will look at how the healthcare landscape is changing and what are the possibilities in the overall context in the ecosystem changing and the healthcare landscape changing. So what is possible? And then any other participants, if they are looking at setting up their own venture or wanting to learn a little bit more about the space, I think it will give them enough understanding of how to go about it. So if I can share my screen. So I just wanted to quickly probably take a couple of minutes and introduce what Portea does. So Portea started around 7 years back, and the whole idea behind the company's concept was that India healthcare market was driven a lot by corporate hospitals. So corporate hospitals have been there for last 20 odd years or so, and have reached out to many of the tier 1, tier 2, tier 3 cities. So we realized that there's a willingness to pay, and there is a basically ability to consume, or willingness to consume high quality healthcare services was being built in the India market, and consumer was ready to basically consume healthcare which is of high quality and at the right price. What we saw was an open opportunity. We were saying outside the hospital healthcare market was still very, very nascent. So what happens before you get into the hospital, what happens after discharge, I think those parts were still not very, very well covered in a professional manner. And the whole idea behind Portea's genesis was that saying, can we get into this space and create a robust outside the hospital healthcare company, which can support patients with high quality healthcare, hospital-like healthcare at the right prices. So that was the idea behind starting Portea. And we looked at basically 4 key verticals which we are looking at building, which is around primary care, chronic disease management, elder care, and post-operative care. So if somebody gets admitted into a hospital for a surgery or a procedure, and once he gets discharged, that is post-operative care. Of course, primary care is about visiting your general physician for infection management and so on and so forth. Physiotherapy, chronic disease management includes all the disease like diabetes, hypertension, and sleep problems, which probably will be with you for lifetime, and you have to learn how to manage that and live with it happy and healthy. And of course, elderly care, which India has, though is being called or hailed as a country with a lot of young people. India also has close to 12 crore people who are 60 plus, and taking care of them is also equally critical. So the 4 care segments which Portea has been operating in. And of course, there are multiple services which we offer as part of that. That is physiotherapy, nursing attendant, nurses, doctor visits, diagnostic services, mother and baby care for new mothers, and as well as the equipment. So other thing which we do, medical equipment is a key part of what we offer. So the whole idea behind this is that once we enter into a relationship with the patient, can we manage their complete healthcare requirements at home or on their offices, apart from hospital, of course, because for tertiary care you have to go to the hospital. For everything else, our idea is that we come to your home or a place of choice and support you with all the healthcare needs. And the whole model is built around extensive patient engagement. So once we enter into a relationship, we try to make it a lifetime relationship with both with the patient as well as with the family. The whole model is built around a very, very robust technology platform, because without that, the kind of scale which we are trying to build and have achieved in the last 7 years would not be possible. So we have our own homegrown ERP system. We have a very, very detailed patient engagement, patient management platform. And using that, basically, we engage with all our clinicians who go to the patient homes. Of course, also engage with all our patients and their family members on an ongoing basis. Very, very robust medical team, because that's another core of this business to be built. And what we have done in the last 7 years is that we have been able to build a fairly sizable outside the hospital healthcare company. We basically serve close to almost 25,000 patients in a month, and we acquire almost 12 to 15,000 new patients in a month, and do close to 150,000 patient visits in a month to patient homes. We have around 4,000 people across the country, present in 22 cities, and continuously growing in adding newer and newer verticals basis what our patients require and what they ask for. And of course, how the market has been playing, and how we can continue to support patients for all their medical needs in their place of choice, that is either home or the corporate. So this is a little bit about our journey. We started in 2013, the first organized large healthcare home healthcare services provider. Of course, started with physiotherapy and nursing services, and continue to build. A couple of years down the road, we acquired a couple of companies to support us in other services, which is medical equipment, as well as the specialty pharma. And then, of course, from there, we have continuously added services in the last 7 years and have continuously grown. We signed up almost all the large hospitals we work with as their home healthcare provider. Manipal, Columbia Asia, Medanta, Narayana Health, you name any of those large fortes, all the large hospitals where we've been present and working with them to build a large home healthcare services play for them. Of course, continuously added services. You see the things like ICU at home. That's something which we launched a year and a half back or so. And the whole idea is that patient, after he's in the hospital and is basically getting treated in the ICU, post-ICU discharge can be either for end-of-life care or for recovery, where they don't need to be in the hospital ICU, because after procedure is more of like stay and being under observation. The whole idea is, can we manage the whole critical ICU setup at home for the patient and support them? That's something which we launched. And at this stage, when we speak, we are managing anywhere between 150 to 170 ICUs at home right now across the country, where the complete setup, including ventilators, monitors, doctor availability, 24/7 nurse, the complete monitoring, all of those things are provided like a hospital level ICU care at probably 1/3 of the cost. And it is done in basically consultation in continuation of the treatment being offered at the hospital, done along with the hospital treating doctor, to make sure the patient gets the same level of care at home also. So the complexity of what is possible to be done at home is something which a service like this shows. Of course, we provide oncology care at home. We do even chemotherapy at home. We do rest of the PICC line care, port flush management, all of the things which are done either in a daycare in the hospital or in even things like ICU, we are being able to manage at home, and have served close to 1 million patients so far, have won a lot of awards for what we have been able to do. Because in general, this concept, having patients and clinicians both not within the premises, I think all the healthcare before that, one of the two is in the premises. We are probably the first large organized player where both of them, whether patient or the clinicians, both are not with us, not in our premises. And we were able to create a large scale operations and a large scale business to run that very, very effectively. And that's all these awards show for that. So I've taken this slide basically till 2019 journey, because 2020, everything changed for everyone once the COVID advent happened in late 2019, early 2020. And so what happened with COVID actually, and I would talk a little bit about what happened with us and what happened in healthcare. Of course, uh, first quarter in this year, of course, everybody looked at saying that this is a crisis which was happening somewhere else, in China and some other countries, and we had various theories about India being impacted by it significantly or not. But of course, as this crisis set its foot in India, the crisis started becoming bigger and bigger. And you realize by April time frame that the way healthcare was consumed before that, people were wary of going to the hospitals, people were wary of having anybody else come to their homes, and in general, the mobility factor of the patients or even healthy people got totally curtailed in this. I think there's one big change which happened. A lot of people started working from home in April timeframe, and of course, India started seeing the surge of COVID positive patients starting from April. And this basically created, or this pushed us and of course the whole healthcare ecosystem in the country to look for innovative solutions so that you can support patient in the completely new dynamics, in the new environment which got created. And it has been quite rapid. So the way the whole thing has unfolded, the timing has been very, very short. I mean, what you would have done probably in starting a new company or starting a product, maybe in 3 months, 6 months, you had 2 or 3 weeks or 4 weeks to think through that and start actually. So what we looked at as one of the innovative solutions, and also how to support the country and the patients in this crisis, we looked at how we could manage and support COVID positive patients at home as much as possible. But that has been our skill, and that's something which we started working on the model. We have done infection management before that at large scale for many of the patients. And then we looked at how we could morph that product into creating something where we could go and support patients at home. So of course, initial stages in April timeframe, first government was saying that all the COVID positive patients were to take into a facility. And then of course, sometime late April, it got decided at a regulatory level that COVID positive patients who are asymptomatic or mild symptoms can be managed at home. And that's how this whole idea came into play. So we started working with a couple of governments in May timeframe and said, can we work together and manage COVID positive patients at home? So of course, the first program which went live was with the Delhi government. I'll give you a brief of how the whole process worked. So this became a perfect combined efforts between us and the government, because with all the lockdowns and everything, the mobility on the ground was very, very difficult. So the way we created the program, that we, given our medical expertise, given our teleconsultation expertise, given our patient management expertise, will pull the whole program together. So the way it works is that everybody who tests positive, government will get the list of those patients and look at who are those out of those patients who can be home isolated. Of course, with that list will get shared with us, and the complete medical SOPs and everything around that got created along with the government. Very fairly detailed SOPs got created which were all basically loaded into our patient management system, and that the list comes to us, and we have a pool of healthcare workers who are well trained on managing this COVID positive patients. So every patient who's supposed to be home isolated gets onboarded by a healthcare worker with a detailed onboarding call, and then of course gets followed up through the isolation period of whether it was started as 17 days, then of course became 14. Nowadays, the government regulation is around 10 days. So during that period, how do you manage that patient completely? You talk to them every day with a healthcare worker. You do doctor teleconsultation for them wherever needed. Roughly 10 to 12% of the patients every day require a doctor consult. And then you also manage any of the emergencies which they have, where you can take the patient to the hospital where they have moved to the hospital. In our experience in working in various governments, 10 to 12% patients needed doctor teleconsult every day. Roughly 3% patients needed to be moved to the hospital, and less than 0.1% mortality rate out of this whole process. And of course, the pieces which we did totally, we pulled the whole thing together. Doctors used our system. They used an Android app basically to call to the patient and maintain all their records. They had access to all the central records in one place. And some places government provided a doctor. Otherwise, we use our own doctors. Government provided all the on-ground support in terms of patient visiting visiting patient homes to check whether they are fit for home isolation or not. Any of the escalation management, any of the emergency management was done by the government. And as a combined effort, this program got launched. We launched it for Delhi, and of course, numbers started growing rapidly. And in last 3 months, this first program went live in May first week. Now we are in August first week. In last 3 months, we have worked with various governments, managing this process for them, and have managed over 50,000 patients successfully in home isolation. So that's something, if you look at total patients who have basically recovered from COVID in India so far, will be close to 12 lakh or so. So roughly 4 to 5% of those patients have been managed by us in home isolation along with governments in a combined effort. And this has basically helped governments a lot to reduce the load on the hospital ecosystem. So earlier model, all these patients would have landed up in the hospital. So saying these patients, of course, don't go to the hospital. It's also a big relief for the patients because they know they can recover at home. And Delhi program was quite successful. Then, of course, other states launched it. And I'll give you a quick summary of what all we have been able to do so far with this particular program. So far we have done this program management for various states, that is Delhi, Chennai City, Bangalore we are doing, Mumbai, Punjab, Gurgaon and Faridabad. Of course, in discussion in many other state governments as well, where this program has been successful and how we can make it more and more robust. Where we can use more technology to make it more scalable and useful for the patients. Done 50,000 plus patients, managing close to 2,000 patients a day on this right now. So the other highlights I talked about, but I think the big positive out of it has been that the relief on the healthcare ecosystem has been fairly high. I mean, if you look at the other developed countries, with Italy and Spain and US and other countries also had tremendous load on their hospital ecosystem. India, we have been able to support governments in our own small ways to reduce the load on the healthcare ecosystem. Of course, we did a lot of other programs as well. We ran mobile clinics in Bangalore. Bangalore gave their BMTC buses, and of course, we partnered with a couple of other players and ran mobile clinics where these buses will go to various societies and people could come and show their symptoms and get consultation with a doctor and any blood test if they wanted to do that. Of course, ran a chat bot for one of the governments, Goa government, in the initial days to give all the COVID-related information when it was really early stage. So some of the other initiatives also which we have launched, which has been able to support the government and the country in managing this whole crisis. So I just wanted to give this as an example and say any of these situations, and that's where the healthcare market in India is going. And I thought we'll talk a little bit about where the next set of opportunities and challenges are coming and how the healthcare ecosystem will change. And this one example where we could make the best use of what is possible with our expertise, what is possible with other support system like a government, hospitals, the labs, and everybody putting together to create a solution which is need of the hour, which helps large number of patients, and which has really served the country in this hour of crisis. Here's some of the patient testimonials. I just give a quick one case where a pregnant woman, she was COVID positive. We are managing her at home. And of course, she had to go to labor. And we coordinated with the government in the night to take her to the hospital and make sure and she had a successful delivery also. And there are many examples like that. I just want to give one to give the extent of support which was possible to give to the patient with this combined solution between driven by Portea and of course worked along with the government. Then as we start working on this, we also realized there are other areas, and as the COVID scare became bigger and bigger, and India is getting enough number of cases, given that we are a large country and a lot more testing is happening, we also looked at how we can go to newer areas like communities. So we realized that communities now are looking at, if you get a COVID positive patient, whether they get treated at home or they get treated within their community, within their clubhouse, can you provide oxygen therapy for them? Can you provide whole of nursing support for them? Can you also look at giving people protection programs, which they know that, okay, even if they are not positive, what they need to do to make sure they're protected from COVID. So there's another recent program which we have launched where we are working with a lot of communities across the country and providing them multiple solutions, including doctor teleconsultation, testing on site, the remote monitoring, 24/7 helpline. If somebody, all of us have multiple questions, and if something happens, what will I do? Whom do I call? How do I manage emergency? Can we create a center within the community? We have created centers within the community in Bangalore, for example, where the local authorities have allowed this to happen. So this is another solution which we believe is the need of the hour and will sustain. So the way a lot of corporates, if some of you are aware, will have medical rooms. We believe that going forward, even communities will start having medical centers and medical rooms. And that's something which is started providing around a month and a half back. Again, has been able to support people at large to manage COVID positive patients, as well as manage healthy people also. Their well-being also is being managed at home for them and within the community. So this basically provides the overall sense of well-being. And of course, psychologically, it's a lot more positive for people to be treated at home or within their community. So these are solutions which we have recently launched and are seeing good traction on that. Again, part of what is possible to do in innovation, something in healthcare is something which we have been able to build. Now, talking about how the healthcare sector is likely to change in the post-COVID scenario. So we are seeing some of the major changes from a regulatory and environmental changes perspective. So government, for example, approved teleconsultation. There have been gray areas around teleconsultation and e-pharmacy in the past. Government approved that at fairly quick speed during this time to make sure that that healthcare delivery was becoming easier and easier. And these things, of course, will become more and more prevalent, and the innovation in healthcare will be driven by many of these policy changes which are happening. Of course, home care became a critical part of it. I mean, if you see everywhere, home isolation, Delhi was a big success story. Arvind Kejriwal talked about it, who's the Chief Minister of Delhi. Our Prime Minister, Shri Narendra Modi, talked about home isolation. And this is something which has become, home care has become a key talking point in the healthcare ecosystem in this COVID scenario. And of course, as we have been managing with governments, working with governments to manage these COVID positive patients, other big change which we see happening is in the patient and customer behavior. So earlier, anything goes wrong health-wise always happens to our neighbor. It doesn't happen to us actually. And many of the younger people always believe they are immortal. But today, the focus on the health has changed a lot actually. The people, what they were looking at, preventive healthcare or the primary healthcare, both of those, chronic disease management, because in COVID, you know, that if somebody has an existing lung disease or has an existing diabetes or any of the comorbidities, hypertension and all, you have more likely chances to catch it and more likely chances to have a severe case of COVID with you if you had any of those problems, existing chronic diseases. So patients' awareness to take care of their health is increasing multifold actually. And we are seeing that in our other offerings also, which we have for the patients. So we believe that focus on health is going to change tremendously. Focus on wellness is going to change tremendously. Focus on preventive care, focus on chronic disease management will change tremendously. Of course, customer behavior is changing. There's so much of work from home is happening. There's so much of technology usage which is happening now. So teleconsulting, point of care devices, those kind of things, the acceptance of that in the healthcare ecosystem is going to change tremendously. Corporates, for example, I mean, work from home is going to be the norm actually. So 25%, 50% of the people will work from home. So companies will look at how they can support their employees at home also. I mean, what we call medical rooms in corporates, the medical rooms inside the premises, and then of course medical rooms, virtual medical rooms, which are available for people who are working from home. So we believe that whole ecosystem in terms of working remotely, being remotely connected, using technology, taking care of a health is going to change significantly. We already see that in the last 4 or 5 months, and we believe that it will increase more and more. The other healthcare ecosystem players like pharmaceutical companies, insurance companies, doctors, hospitals, each of those will look at how they can start supporting patients remotely. I mean, we had so many of requests from some of our pharmaceutical companies partners that how can we take care of their patients who would have gone to a hospital earlier, like a cancer patient or a patient who needs dialysis. All of them would have gone to hospitals or the centers for their support, medical support. We are looking at how we can do that at home. We have done so many chemo sessions at home in last few months because companies are looking at how they can support patients at home because they are very vulnerable in terms of going to outside and catching the infection. So that's something which is picking up, gaining ground in a big way. Other big change which happened is that IRDA basically approved saying that all insurance companies were to cover COVID home care also as a couple of programs on COVID support, that is Kavach and COVID Suraksha. So those programs also cover home care. So if you look at from a home health care perspective, that's another major change because home care was not covered by insurance companies in the past. Now with this particular COVID care, the home care also is getting covered, at least COVID care is getting covered by insurance companies in their policies. And we believe that a lot more is possible to cover as we go along. So there's another major change which is going to happen, which is already in works now. I mean, we are supporting so many patients through our insurance partners at home for their COVID care. And we believe that that's something which again will be a very big change in the macroeconomic factor, as you could call. These are macro factors which are changing as far as healthcare is concerned and consumer behavior is concerned. Of course, the new healthcare dynamics, as I said, home care has moved from being nice to have to a must have. Hospital, clinics, home care will complete the care continuum actually. So I mean, if you would have noticed, Apollo mentioned some time back that they are looking at roughly 50% of OPD consults to go in teleconsult in next 3 years. That's a really big change from a healthcare delivery perspective. What it allows or what it supports is that a lot of tier 3, tier 4 cities where such kind of, or villages where such kind of robust healthcare system or healthcare infrastructure is not available, could also avail the same level of healthcare services, leveraging the teleconsulting piece. So that's again a major change which is in the offing, which is already happening. Of course, hospitals can look at home care more robustly to continue with the care continuum. And of course, ecosystem players are going to leverage being connected to the patient in a remote way, in a big way in the coming few years. That's how we see it. These are some of the new healthcare dynamics which we see are playing out now and will continue to get built for a period of time. Other 2-3 areas which I believe will change significantly from a healthcare perspective. Community health will become much bigger. So if you look at elder care actually, so if you look at a lot of deaths which are happening in Italy and US and all, were all happening in the assisted living homes actually. So India, given that we have so much of elderly population who are staying at homes, not and many of the people still stay with their families, how can you take care of elderly at home? How can you leverage community? India has a strong network of primary care centers. How can you work along with governments, leveraging those primary healthcare systems and primary healthcare center infrastructure to take care of the elderly in the community? So they don't necessarily go to the hospital or to the clinics, but the high quality healthcare comes to them at their doorstep wherever they are. And all the healthcare workers, ASHA workers, and everybody who's already in the ecosystem, how they can basically support these elderly in much stronger manner. Other area which we see tremendous opportunity and changes is from an infection control perspective. So a lot of patients who are getting an infection, should they go to a hospital, should they go to a clinic, or can they do a teleconsult, whether they do it with a hospital or do with a teleconsultation service provider. But the fact is that the infection management can be done in a more and more robust manner and a remote manner. So if you look at the new government guidelines and new government healthcare policy, infection control, infection management at the community level, at the district level, at the local level also is going to become significant. For each of those, you don't need to go to the hospital. So can you create infrastructure? Can you create network? Can you create expertise around infection management? That's another big area which we see will pick up once this whole COVID scare comes on. COVID itself is a like sort of infection, right? So the way COVID gets managed remotely, which we are able to demonstrate, and of course, a lot of state governments are working on this now. Can other infections also be managed remotely as much as possible? So the way you see that test, track, and treat is something which you can do for any of the infections, any of the diseases like contagious diseases like that. So we believe that elder care, chronic disease management, preventive care, wellness, home care, of course, infection management, each of these areas, with the more use of technology, the more use of centralized expertise, the more use of managing this healthcare in a distributed manner in a community at a community level will unfold in a very, very big way in India. So next 10 years, 20 years, healthcare is going to be a very, very big focus because we have to catch up from an infrastructure perspective as well as readiness perspective on how to handle a pandemic of this nature if we were to recur, which, I mean, today we know that, okay, these kind of things are possible. So as we manage COVID as a country and get victory over it in next maybe few months, year or so, this also opens up completely new dynamics in the healthcare environment to create offerings to support patients in the easiest possible manner, leveraging technology. And tremendous business opportunities are available today to create new ideas and build on those ideas to support the patients. So I would stop at this. Are there any questions? I'll be happy to take.
Thank you, Vaibhav. So we have a question here from Pali. Are teleconsultations as effective as physical consultations, where a lot of tests or checks the doctor might have?
So I think teleconsultation in many of the cases is quite effective actually, and of course there's something which will be used more and more. So I think of course nothing is equivalent of a doctor seeing you in person, but I think teleconsultation is almost equally effective and is being used a lot in many cases already now.
Right. Currently operational and now.
We are working with almost 8 states right now as we speak.
The questions. How does the whole dialysis thing out, like for example, you said, a lot of patients who are a little hesitant to go to the dialysis wards. How do you it happens smoothly?
So dialysis basically there's a partner called NephroPlus. We work with them basically, and there's a complete setup of equipment at the patient home, and it gets set up. And then of course, because dialysis you have to do 2 or 3 times in a week, so it is a fairly engaged process, and that's something which gets done along with the partner right now, and works quite effectively actually. They also launched dialysis on wheels. Actually, this is a mobile van which will come to your facility and do dialysis for you at home. So that's again something which is working well now actually. So some of these things which were only possible in a clinic or in a hospital setup earlier are being done at patient home quite successfully, and these will only grow. Of course, this will happen for some of the patients who are probably not as mobile as you would expect a normal patient to. So if you can go to the hospital, some of them may still go, but it's very, very useful for patients who are not very mobile.
Great. See, do you have any more questions? Also, so another focus area for Innopark Ventures is the field of medtech, and Portea Medical has now been in this field for, like you said, 7 years. What do you say is the scope? I mean, do you still think there's a lot of things that Portea Medical can cover of your business, improving or more new services that you could add?
I believe that, see, from our perspective, everything is built around a patient demand. Actually, I mean, we believe mental health is another area which is going to be very big in the country, right? So, I mean, can you support Can you support people? I mean, that has been a taboo in India in many ways, right? We don't talk about mental health, but that's another area which I believe is a tremendous need actually. And if we can find ways to take care of Indian consumers and in the way they think about it and how we basically support them, I think mental health is another big area to work on.
So is Portea Medical going to venture into that field also very
We are
soon?
looking at how to support patients, of course, very, very early stage. Yes, we are looking at that.
Right. So I think that's given an opportunity today because, this being a our Matchathon, which is like a much bigger event, we are inviting either various fields, medtech. So any more questions?
I'd actually like to thank Vaibhav for bringing up the mental health issue. Vaibhav, most of the people we engage with are founders, entrepreneurs, student communities in the tech and engineering backgrounds. And obviously, they're subjected to severe pressure, whether one agrees or not. And it has been such a taboo. People write to us one-on-one saying, one of the biggest things is not even raising funds. It's just the day-to-day stress that we deal with. So we sincerely hope that Portea supports this and makes it sort of a non-taboo thing to pursue for anybody. It's as much as we take care of physical health, well-being, we must take care of our mental well-being. So thank you for bringing that up, and I hope we all hope that we see Portea's efforts towards that very soon in the market.
Yeah. Yeah, I mean, entrepreneurship, of course, has its own set of demands and challenges. So, of course, you build anything new ground up, it is like raising a new baby. And anybody who has been a mother or has been a father will know what it takes to basically grow up a baby. And companies are the same way, actually.
Right. So do we have any more? Sita, do you have any questions?
No, I think Vaibhav's nicely covered everything that I wanted to ask. In fact, I had a list prepared and it was such a comprehensive and informative session that he walked us through that most of it has been answered. Let's ask the audience. And if the audience, Vaibhav, we will have this up on social media platforms. If there are any specific questions for you, we will collate them and Joanna will email them to you, so you can answer them, and we will also put up the answers on the social media platforms.
Sure, great.
Time today, Vaibhav.
Thank you. Thanks,
Thank you everyone for joining today. It was really quite an informative one. Please log on to Portea and check out the services. I think that we did beneficial to everyone now. Thank you, everyone. Thank you, Vaibhav.
So, thank you, Vaibhav.
Day.
Thanks to Portea for all the wonderful work. Thank you. Bye-bye.
Bye-bye.